President and Chief Compliance Officer at Micro Labs Limited. He brings prior experience from leading pharmaceutical companies like Zydus, Cadila, and Cipla. Ganeshan, an Annamalai University postgraduate, is known in the industry for his vast product knowledge. As a key opinion leader in the industry, he has a robust skill set that includes operations management, pharmaceutical sales, and hospital sales. He will talk to us today about the pros and cons of medicine and mental health and the importance of adopting scientific temper instead of superstition and stigma. I request you to turn off your mic now, all of you. We will take questions after the talk. Once again, thank you, Mr. Ganeshan, for being with us today. Over to you, sir.
Yeah, thank you. Thanks for your warm welcome. So I will try my level best to justify the topic that has been given to me, which is pretty deep. So with whatever knowledge I have, we will try to discuss and understand mental health. Now, actually, if you look into delve a little into the evolution of psychiatry, it all started, a psychiatric patient was considered to be some kind of an evil, some kind of a, stigma, and they were kept initially chained, and then they were kept in isolation. They were kept in, what was called as the mental hospitals, where, they were, not treated on par with what a normal human being would be. And this was something that was going on, and it was very difficult, and people didn't understand why a person was behaving that way, and they attributed it to spirits, they attributed it to the curses, etc. And then this was a field that was not understood for a long time. Also, I'm sure all of you would agree that the one thing that differentiates man in the whole animal kingdom is his brain, because man is today evolved and considered evolved, and is ruling this planet only because of that one organ, that is his brain. But because if you really look at the physical strength, his physical strength compared to various other animals, his compatriots, is much lesser. But then he still rules this planet basically because of his mental acumen and this which he has developed over a period of time. So therefore, what I'm trying to tell you is that for a human being, his brain and his brain acumen and his brain functioning is of utmost importance, right? So coming back to the evolution of psychiatry, in 4th century BCE, it was Hippocrates who first tried to understand the physiological abnormalities that could be the root of mental disorders. Later, there was a Harry Stack Sullivan who developed a theory of psychiatry based on interpersonal relationship, and Philip Pinel, who is known as the father of modern psychiatry, actually brought in, I told you, these patients of psychiatry were not treated on par with the other human beings. So he was known for bringing a humane kind of a treatment for the mentally ill. And he started working, and he was more of a psychotherapist, and he believed, see, when you look at, I will later, substantiate, there are two aspects to mental health. One is psychotherapy and psychopharmacology. So he was more of a psychotherapist, who tried to actually, improve the condition of the mentally ill. So this is, and then there was Sigmund Freud, and the list goes on and on. But then over a period of time, psychiatry developed, and today I'm very proud to say that even in the last year, the postgraduate seats for MD psychiatry has increased by more than 30%, which very clearly indicates the government's seriousness in handling the psychiatric illness. Also, the Mental Health Act, etc., which are now in place, actually gives a lot of benefit in terms of the care that a person who is mentally ill could get. Okay. Now, I would like to say that there is no health without mental health. So, what is mental health? What is the definition of mental health? See, mental health is a state of well being that actually enables the individual to cope up with life stresses. Now, every human being is stressed. Everything is stressed, right? From going to your office, working, doing your job, then earning a livelihood, then meeting social demands and fulfilling familial needs, etc. is it's become a stress. And then the mental state of well-being is that which actually helps a human being to cope up with this stress and still live on this earth the way he should, right? And mental health actually supports personal abilities, right, which is very important for interpersonal skills and other abilities. Then effective learning, because see, what was perfect yesterday is imperfect today. So the process of learning is very continuous, and this cannot happen without mental health. And then ultimately a human being is expected to deliver meaningful work and be useful to the society. So all this is possible with good mental health. So it contributes to the community in terms of engagement and societal development, and therefore that's why man is called a social animal, and he lives in the society, and he can be a part of the society in an effective fashion only when his mental health is maintained. So also, mental health is a basic human right. Why is it a basic human right? Is that because initially there was a lot of importance that was being laid to physical health, but today mental health is even the Indian Mental Health Act says that there is a right for a basic right for mental health, and that a person has a right to live in a good mental ability. So so because ultimately it is an integral part of decision making, and it also is useful in making the society recognize a human being as how he should be. Now, if you really look at the psychiatric disorders today, you have, I have enlisted some of the psychiatric disorders which I would like to go through. The most common psychiatric disorder that we come across is the anxiety disorder. It's not that a normal human being doesn't feel anxious; he does feel very anxious. Everybody has anxieties day in and day out. But then, if this anxiety becomes an excessive thing, and a person starts worrying for everything, then it leads to something called as anxiety neurosis, and this is a pathological condition which has to be treated. Otherwise, the anxiety can lead to various other problems. Mental health, what happens is when a person is anxious, his sympathetic overtone is there. If sympathetic overtone is there, more noradrenaline is produced. More noradrenaline is produced, heart rate goes up. If heart rate goes up, the blood pressure goes up. So mental health is also in a large sense connected to physical health or physiological health. So therefore these cannot be left untreated. So therefore a person normally can feel anxious, but then over anxiety or being unnecessarily worried about something could be pathological, and this can be easily identified and diagnosed by a psychiatrist. Depression, see, persistent feeling of sadness and loss of interest in everything. People are, the person is sad, melancholy, not for any good reason, but he himself or herself does not know the reason, but then the person feels sad and he's lost and he is not interested in anything. His good food is not interested. He's not interested in social, gatherings. He is not interested in anything. So therefore, this is this condition has to be treated because it's psychologically wrong. Then depression can turn into MDD, which is major depressive disorder, and major depressive disorder has to be treated very effectively because major depressive disorder is considered to be one of the most important cause of suicide, and a person can harm, and it can lead to death of the person. So therefore, MDD has to be treated. Bipolar disorder. So bipolar disorders is extreme mood swings. It's an extreme mood swing between depression and mania. So this is again a psychotic condition which has to be treated. Post-traumatic stress disorder. See, now what happens in a person has a trauma, and each time he remembers about the traumatic condition, he actually again goes into an anxiety neurosis. He has a sudden increase in heart rate. His breathing becomes different, and he needs to be taken care of. It can even lead to an emergency. So therefore, whenever a person depicts or exhibits symptoms of post-traumatic stress disorder, he needs to be taken care of. Schizophrenia, of course, we know is split mind. He has hallucinations, delusions, and disorganized thinking, right? So this is again a major disorder which needs to be treated on a war footing, basically because he could harm the society, he could harm the people around him, he could harm himself once again. Now there are eating disorders. Now there are two types of eating disorders, namely bulimia nervosa and bulimia anorexia. In bulimia nervosa, the person goes on eating, excessive eating where he has no satiety. In bulimia anorexia, he doesn't eat anything, he doesn't feel hungry at all. So this is again another disease that needs to be treated. Then there is also something called as OCD, obsessive compulsive disorder. Now, obsessive compulsive disorder is a condition where the person goes on doing the same thing repeatedly again and again. Person keeps on washing hands. Person locks the door, checks, locks the door, checks. See, this is called as obsessive compulsive disorder, and this has to be treated. Disruptive behavior and dissocial disorders, then neurodevelopmental disorders. See, what happens when the child is born, the child could get into a perinatal distress, and therefore could have certain developmental issues, or genetically the child could have developed some issues as a child, and then that carries on, and the person has to be dealt with differently. Substance abuse, which is very, very common. See, today substance abuse in places like Punjab, etc., has become so high, that the government is taking some stringent measures to actually curtail this. And then those who are addicted, they need to be de-addicted, and de-addiction itself is a very big branch of psychiatry. And lastly, I have added one more called the nomophobia. Now, you can say that almost all of us suffer from nomophobia. Nomophobia is a phobia that happens when you don't have your mobile in hand. You feel very stressed. You are always fiddling with it. It's not correct, actually. One of the lifestyle measures is always to practice being without a mobile for at least 2 to 3 hours in a day, because otherwise it's becoming so addictive. People become phobic when the mobile is not. They feel that they've lost something, a part of themselves. And even people think that mobile is the most important thing. People are willing to share anything and everything, but not the mobile. So therefore, this is becoming phobic. An instrument which was actually required for or was useful for communication has now become a tool of a major distraction. So now, why do all these psychiatric disorders occur? Now, the nerve endings or the synaptic clefts have various neurotransmitters like serotonin, norepinephrine, dopamine, glutamine, and acetylcholine, etc. Now, what happens is that these neurotransmitters are present in such a what you call combination that a normal human being lives normally. But unfortunately, in a person suffering from anxiety or any of the or depression or any of the psychiatric disorders, the issue is that there is a change in the interplay of these neurotransmitters, and that is the reason why the person does not have a normal mental health. So when you look at most of the drugs or many of the drugs, they act on these nerve endings, or to be precise, on the neurotransmitters that are present in the nerve endings or the synaptic cleft. So therefore, you'll find that the drugs act at the level of serotonin or norepinephrine or dopamine or glutamine or acetylcholine in order to modulate, the nerve impulses, and therefore mitigate the problem of psychiatric disorders. Now, mental health exists on a spectrum from well-being to mental disorder. See, what happens? The mental health is in a spectrum. Like, it's not that everybody have similar kind of a mental situation. Now, somebody is mild, somebody is moderate, somebody is very severe. So there is a large spectrum, and each person behaves in a different way. So therefore, treating a person suffering from mental illness is a highly individualized kind of a thing, which the psychiatrist has to do with a lot of diligence and intelligence. Because what happens is, like, for example, there is a patient with let's say a psychotic disorder. He responds very well to olanzapine. A person with a similar symptom may not respond to olanzapine, but then the doctor may find that he works better with amisulpride or some other drug. So therefore, what happens? Treatment becomes individualized. So therefore, a patient cannot say, see, my symptoms are similar, his symptoms are similar, so the treatment could be similar. No, it doesn't happen. Because of the varying difficulties, varying degree of difficulty, distress, and also the potential outcome or prognosis of treatment, mental health and treatment of mental health is highly individualized, right? So if you look at the mental condition of a person suffering from mental illness, he could have mental disorders, he could have psychosocial disabilities, and he could also have distressing mental states. So it's not that a person is always in a distressed mental state. He could be normal for 10 hours, 12 hours in a day. 2 hours the whole demeanor could change. So it depends on how you need the doctor. That is why the psychiatrist is very thorough in spending a lot of time in taking the history. History taking is very important in psychiatry, and therefore he actually tailor makes or dovetails the treatment based on the history that he takes from the patient. So it's very important, because certain drugs itself can cause certain harm. So therefore, the doctor knows which drug would work where and how it would be beneficial to the patient. So therefore, going into or trying to experiment with medications in terms of saying that because a person has this similar thing, I could also take this medication and then benefit. That is a very wrong kind of a strategy, because mental health has to be dealt by a specialist, and then it's always better that a psychiatrist handles, because he knows what would work for whom, right? So all of us are theorists. Ultimately, it is he who clinically sees the patient, decides based on his acumen, what needs to be given and what should not be given, right? So therefore, you need to be very cautious in approaching mental health. It cannot be treated by oneself. It has to be handled by a professional, right? Now, as I already told you, that the disability of mental health impact is very large on the society, because See, any other disability, like if somebody has, is lame, maybe he could use, if he had a problem in the limbs, he could use, a wheelchair or something like that. He could always, be contributive to the society and could improve the economy of the society. But unfortunately, mental health is such a crucial thing that when mental health fails, it is very difficult for the person to be able to contribute to the society unless this is rectified. Now, let me also tell you that there is no mental health which is not manageable. And today, the spectrum of medication and psychotherapy is so well advanced that mental health can be virtually normalized by a specialist when you go to a psychiatrist. And though we see when we go to meet a psychiatrist, so many patients in the clinic, you'll find that all of them are contributing, are working, are doing their duty, are doing their job effectively. And I mean, at least not all, most of them are. So therefore, the mental well-being is very key to thriving communities and economies. So this, keeping this in mind, always the psychiatrist ensures that the right kind of treatment is given and that the person is contributing to the well-being of the society. Okay, now I told you that psychiatry as a branch, I mean, like as a medical branch, has expanded to a large extent. So today you have so many branches in psychiatry itself. You have child and adolescent psychiatry, you have addiction psychiatry, you have forensic psychiatry, you have geriatric psychiatry. Forensic psychiatry, in fact, the forensic expert, even after the patient dies, they try to, build up the case and then try to understand what went wrong so that the further treatment can be, I mean, that the treatment it could be much better. And then they try to understand the insight as to why, what happened, why it happened, why the treatment failed, or how the patient managed. So forensic psychiatry is very important, particularly in suicides. Then geriatric psychiatry, neuropsychiatry, community psychiatry, rehabilitation plays a very important role. Biological psychiatry is catching up, psychotherapy, and sexual psychiatry, and many more branches. So psychiatry has become, I mean, like, from what it was as a very obscure kind of a branch where people were kept in the mental asylum and chained and treated. Today it has gained a lot of importance, and you find that there are so many branches which are actually very specifically treating patients, hand holding them and bringing them back into the main fold of the society. There are The advancement in psychiatry is very large. And the better understanding of neurotransmitters, which I told you, is a major, I mean, the interplay of these neurotransmitters are key to mental health. And that whenever there is when the interplay is affected, there are medications which normalize them. Then genetics, neurobiology has led to a lot of research and has led to more targeted psychiatric drugs and advancement to improve treatment and outcomes for many patients. And therefore, things have become better. But of late, we find that there are certain challenges in psychiatric drug development. There is decreased investment by pharma companies because it's getting saturated. And there is a shift in focus. Many companies are shifting focus to areas which they feel is more important, like cancer, metabolism. Particularly, if you look at a disease like diabetes, you have so many. Every month, every 2 months, you have a newer entity coming in, but which is not there with psychiatry. But then, despite all this, we still have enough medications to ensure that the patient his well-being can be taken care of, right? So ongoing issues, bipolar patients the patient still experience. See, what happens is, despite area where patients still experience severe depressive episodes despite multiple medications. See, in fact, these psychiatrist tries to approach the disease in multiple angles with still wanting. And there is autism, which is very difficult to treat, certain cognitive impairments, and cause severe social deficits, and they are very difficult to treat. So anyway, the hope of the future is that a lot of genetic research is going on in the field of psychiatry and neuroscience, and these discoveries are believed to be paving way for newer type of treatment and disease management, right? So there are emerging tools like stem cell derived neurons, which would offer human based model, which would offer much better treatment for the human beings. And also you have psychotherapy. See, one of the most important aspects today is psychotherapy. So in addition to pharmacotherapy, you have psychotherapy, which is an important part or aspect of treatment of a person suffering from mental disorder. So with this, let us have a look at the pharmacotherapy that are available today in the market. Now, there are five main groups of psychiatric medication. We'll go through each one of them. Now, I would look at antidepressant as the first, because most often than not, the largest psychiatry or a mental illness is depression. So therefore, the antidepressants are very important tool for a psychiatrist in taking care of this disease, which is so prevalent. Now, here the most what you call accepted more, drug is the selective serotonin reuptake inhibitors. These selective serotonin reuptake. See, serotonin is a happy hormone. Now, these drugs play a very important role in ensuring adequate amount of serotonin is available in the synaptic region, so that the person does not feel depressed. So therefore, there are drugs like paroxetine, sertraline, fluoxetine, citalopram, and fluoxamine, which belong to this class. And out of these, paroxetine, sertraline, and citalopram, and also fluoxetine are used by the clinician very often, right? Fluoxetine is also a very important drug in the treatment of OCD, that is obsessive compulsive disorder, which I talked about. Now, parallelly to this, you have something called as the serotonin norepinephrine uptake inhibitors, which are called the SNRIs, and these are also a very important treatment modality that is available. And you have drugs like venlafaxine, duloxetine, desvenlafaxine, melnicipran, and mostly levomilnicipran. These are the drugs that are available. So here it's a double-pronged attack. That is, it works at the serotonin level. Also, it is believed that lower levels of norepinephrine is one of the reasons to cause depression. So therefore, many of the doctors believe in giving a kind of a double attack on both norepinephrine and serotonin, thereby gaining better control of depression. Then you have a set of drugs which are called the non-epinephrine dopamine reuptake inhibitors, which are called the NDRIs, like bupropion, which is also used very widely. And today you have bupropion also in combination with dextromethorphan hydrobromide, which is considered to be very useful and extremely. Actually, dextromethorphan hydrobromide was a drug that was actually used for as an anti-cold. But one of the side effects of this particular product was that it could actually excite a person or reduce the problems associated with depression. And therefore, today you have a new a drug, which is a bupropion plus dextromethorphan hydrobromide combination, which is used in severe depression to a large extent, very successfully used by the doctors, and it's just started. It came into the market about 6 7 months ago, and it is doing well. And then there still we need to look at more trials and understand how these drugs perform in severe depression. Tricyclic antidepressants are old drugs. You have amitriptyline, nortriptyline, imipramine, so on and so forth. Of the lot today, you will find that amitriptyline, nortriptyline is used, and also dothipin, which is very commonly used. So these are the three main are amitriptyline, nortriptyline, and dothipin, which are commonly used in the management of depression. Now, if I will go into the side effects also separately, but then I want you to understand one thing. The most common and the most important side effect of most of the SSRIs is sexual dysfunction. So therefore, you will find that these in the younger age group of patients, SSRI could compromise their normal sexual life. So therefore, that is one thing. Particularly drugs like escitalopram are believed to cause a lot of these sexual dysfunctions. So a doctor is always wary about it. He knows it. He keeps it in his mind when he's prescribing, and he also keeps monitoring and checking when the patient subsequently visits on this parameter. Now, as far as tricyclic antidepressants are concerned, drowsiness and people feel very sleepy. Particularly drugs like dothipin and nortriptyline, amitriptyline cause large amount of sedation. So the doctor watches out for these, and then he is looking out whether the patient is having any issues with which is not, it should not cause excessive drowsiness, so that it may come in way of his normal life. So therefore, that is one set of this one set of drugs. He always keeps looking for this particular side effects. Then there were drugs called the monoamine oxidase inhibitors, but because of very severe side effects, now the usage has somewhat come down. So let us not get into these drugs. Particularly moclobamide, etc., was being used, but today the usage has come down drastically. Now, we've looked at the first set of drugs, which are antidepressants. The second set of drugs are antipsychotics, and these are used to treat psychotic disorders like schizophrenia, bipolar disease, etc., mood disorders. So you have two typical generations. One is the first generation or the older generation of the antipsychotics, and here you have trifluperazine, and which is a very important member, which is even still being used today. And you have flupentixol, and you also have drugs like haloperidol, which you have depot preparations of haloperidol that is available, and they are very useful in management of antipsychotic psychotic conditions, and are very useful antipsychotics. So you will find that of the lot, you will find haloperidol, flupentixol, and also you say trifluperazine, which is being used very commonly in these condition. Then you have, of course, now the second generation antipsychotics, which are also called as the atypical psychotics. Now, if you look at the atypical psychotics, they have much lesser side effect profile than the older ones, that is the first generation. And you have clozapine, you have olanzapine, and you have risperidone, you have paliperidone. Paliperidone again is something similar to haliperidol, but then you will find that the side effect profile of haliperidol is much lesser. You have ziprasidone, you have lurazidone, you have aripiprazole. Quetiapine is being used extensively today in as an antipsychotic, and you have also you have brexpiprazole, and which is relatively new, and we need to understand how this drug is going to. And then amisulpride is today being used very commonly. Basically, olanzapine is a drug which is a very good antipsychotic, but unfortunately olanzapine has one major issue, that is weight gain. And by giving amisulpride, that actually has an action on both the positive and the negative symptoms for a patient suffering from psychotic disorder. Plus, it causes less effect of on weight gain. So, therefore, the younger generation of patients, amisulpride is being more commonly used today. Then you have anxiolytics. So medications that actually treat anxiety. It generally includes hypnotics and sedatives. For example, you have certain SSRIs, particularly paroxetine. Paroxetine has got a good amount of anxiolytic effect. So therefore you'll find that when a person has, many a time what happens is that a person does not come with anxiety alone, he has underlying depression, which the history taking will very clearly indicate. So in such conditions, a doctor would prefer a paroxetine. And when a person is having less of anxiety component and more of depression component, you would go for escitalopram. So the doctors have their own way of actually positioning each one of these molecules based on the history of the patient and the condition of these patients. However, you will find that benzodiazepine are the best course of medication in anxiolytics. You have diazepam, you have lorazepam, you have alprazolam, you have clonazepam, and then you have clobazam. See, but one thing is there with most of the benzodiazepine, the major side effect for these drugs is that it causes severe amount of drowsiness. Now, diazepam has severe drowsiness, and then it's also used as a sleep medication. But basically, diazepam is supposed to be an anxiolytic. Likewise, lorazepam, alprazolam. So all these also have very strong addictive potential. Of the lot, you'll find that clonazepam has got less addictive potential, and can be used for a slightly longer period of time. But otherwise, you'll find that most of the doctors will not use these medications for a very long period of time because it causes addiction. Clobazam is again a benzodiazepine, but clobazam is less used in anxiety, but then more so used in case of epilepsy, because in seizures, epileptic seizures, you will find clobazam very useful. And also the doctors prefer to use clobazam in children patients who have epileptic seizures. Propranolol, of course, initially it came in as a drug for the heart, but then it's extra cardiac indication. See, it's a propranolol is a drug that crosses the blood-brain barrier. Blood-brain barrier. There is a barrier between the brain and the body, which is called the blood-brain barrier. So all drugs cannot cross this blood-brain barrier and reach the brain and achieve a concentration in the brain. So therefore, all these drugs are drugs that are able to cross the blood-brain barrier. Now, when you look at the beta blockers, you have propranolol, you have metoprolol, you have bisoprolol, and you have so many others which have come into the market. But of the lot, you'll find that propranolol is a drug that can cross the blood-brain barrier. So therefore, propranolol is the drug that is used in an extra cardiac indication, so much so that today propranolol has lost its relevance in cardiac conditions, but then is used more so in conditions with like for example anxiety. Also you have performance anxiety, which is a very common thing which is seen in patients. A person is okay, but then when he's actually doing about to deliver a talk, about to do a particular task, he has severe anxiety and he is not able to perform the task effectively. So therefore, there a drug like propranolol is of immense value because it has the ability to bring down the norepinephrine levels and then is able to create a lot of comfort, give a lot of comfort to a person suffering from particularly performance stress. And it's also used in combination with clonazepam most oftenly. And it also believes that this combination reduces tremors, etc., which is so commonly seen in patients with suffering from stress disorders. Of course, buspirone is used for long-term anxiety management, but still today buspirone has is used much lesser because it's considered to be a very old generation drug. Now, this chart I want to show it to you because these are sedative hypnotic drugs. So these, like particularly benzodiazepine or non-benzodiazepines, you have benzodiazepine, you have, as I discussed with you, you have diazepam, you have clonazepam, you have lorazepam, you have clobazam, etc. All these have to be used with caution because without the doctor's prescription and without being monitored by the doctor, these drugs are not to be used unless your doctor is aware that you are using, because he is the one who knows what the issues with these drugs, and it can has severe effect in terms of being addictive in potential. Also, you have non-benzodiazepines, but even non-benzodiazepines can be very addictive, particularly zolpidem. Zolpidem can cause quite a bit of addiction. So therefore, all these drugs like zopiclone, zolpidem, and the other benzodiazepines have to be given with not only caution. It has to be given only with the what you call strict monitoring by a medical professional. You look at barbiturates. Barbiturates are very dangerous drugs, and these drugs, particularly the long-acting ones like phenobarbital, could be very killing. And therefore, unless it is strictly monitored by a psychiatrist, it is not to be taken. It's not to be used, right? Then you have fourth class of drugs that are called the mood stabilizers. Lithium is a very good, supposed to be a very good, mood stabilizer. Even today, it's considered to be a gold standard in for treatment of mood disorders. And lithium is excellent. I mean, like in terms of providing relief to patients suffering from mood swings and mood disorders. Then you have anti-convulsant drugs, which also is used as mood stabilizer, but these drugs are used more as anti-convulsants. Valproate, lamotrigine, carbamazepine, and oxcarbamazepine, are the older class of drugs that are used as anticonvulsants. Then you have another set of drugs called the levetiracetam and the breveracetam. These are the newer, anticonvulsant which act at the level of the SGPT levels. And you have lacosamide, which is very useful in focal seizures. So these are all drugs that are used as anticonvulsants. Now you have stimulants, right? So particularly, in patients suffering from, narcolepsy, sleep disorders, where you have to use hypnotics, and hypnotics are used with a lot of caution. And a new entity called the lembaroxant has come into the market, and Devigo is the brand that is available, and it's a very expensive medication, but I believe it is very useful in isolated insomnia, and patients do benefit from this kind of medication. Then you have amphetamine based stimulants. Particularly, stimulants are used in patients suffering from depression. So these amphetamine based stimulants are of value in patients who need some kind of a stimulation, who are down, and in bipolar disorders, when the symptoms are very negative, you need to make the patient positive. So there you need to use these drugs. Now, how would one know if the drug is working, or how can a caregiver know or have a sense that when a drug is working, when a drug is not working? This is one of the common questions that always keeps arising in the mind of the patient and the caregiver. Now, what are the therapeutic effects? Now, what you need to do is always look for altered states. You know, sedation, emotional suppression, cognitive changes, changes in perception, which may reduce symptoms, like whether, so these things also reduce the symptoms of agitation, psychosis, emotional numbness, and depression. So therefore, when you have a person having these side effects, you know that there is also a therapeutic effect that is happening, and therefore on a long term basis these side effects will slowly tend to disappear, and the person becomes more and more move into normality. Then relief of distress. A person who's suffering from mental disorder is always distressed, and if you find that after medication that there is significant amount of relief from distress, or psychosocial disability, it means in the sense that, I'll give you a simple example. He feels very uncomfortable in a social setup, but then after medication he
Excuse
doesn't
me,
mind.
sir.
He says, okay, come, let's go to a temple, let's go here, let's go there, and he's able to cope up with this. Then that means that the drug is working and the drug is beneficial. And the
Excuse me.
drug's impact
Excuse me.
should always be assessed as a part of the overall mental well-being and physical state, rather than focusing only on some particular symptoms. Whether a person is trying to be better, his overall, his eating, his other habits have improved, is he taking more interest in life? These are the things that would actually throw light into understanding whether the drug is impacting or not. Sometimes you may find that, of course, the idea of giving a drug is that you will find, you will want the symptoms to come down, which naturally it would if the drug is working. But then in addition to these, if the symptom reduction is not very significant, you will also have to look for these changes that are happening in the patient, so that you will understand whether the drug is actually working or not working. Pay attention to psychoactive and physical changes which is induced by the medication, such as sedation, psychomotor slowing, or activism. See, psychomotor slowing may be very important for a person who's suffering from schizophrenia. If there is some amount of psychomotor slowing, it really is a good indicator that the person is being, the drug is acting on him, right? Then most important thing is patient feedback. It's very critical for you to understand what the patient is saying, and particularly in terms of side effects, particularly in terms of expression. Now, sometimes what happens, I told you about suicide. A person with depression has tendency to commit suicide, and always, most often than not, a person who is going to commit suicide will definitely express to someone that he's fed up of living or something like that. So that means his antidepressant medication is not working, and you need to immediately contact a psychiatrist, get him to know that this kind of a thing is happening, and then maybe you change the drug, or you would look at psychotherapy, or you would look at some other aspect of treating the patient, so that he can win back the patient. So therefore, you need to take feedback from the patient. You need to take feedback from the patient in terms of side effects. See, certain side effects, we say generalized class effect is seen in so many of the patients, but then there could be specific side effect to the specific patient. So you need to understand that, and you need to look at these feedbacks which come from the patient, and then these adverse effects need to be noted, and one has to take efforts to mitigate the same. Now, there is a new approach which is being used called the collaborative decision making, where we encourage the active patient involvement in treatment decision as a core element of patient centric approach, where we help the patient, we tell the patient what. See, many a times things happen without the patient knowing. Many of the doctors say, sir, we would prefer you to give a drug which is mouth dissolving, which is can be easily mixed in food, which the patient does not know, or something like that. But today what is happening slowly, things are moving towards a collaborative decision making, and where there is encouragement for a patient to get involved in treatment decision, and a patient centric approach, which actually then the patient also knows what is happening to him. He is able to weigh the benefits and the potential side effects, the costs, etc. And then and the caregivers need to give respect to the patient's right, and inform him of the choices, and align the choices to the values and preferences of the patient. So this is one new thing that is coming. The second thing is adjusting drug regimens. Now, this only a psychiatrist will be able to do it, because see, whenever a set of drugs are prescribed in particularly a mental disorder, I told you the treatment is highly individualized. So what would be happening is that many a times you'll find that kind of certain drugs work, certain drugs don't work. So that this kind of chopping off some certain drugs in the subsequent visit, then adding something else, then that kind of a thing is something that could be expected till the psychiatrist, when he, in history taking, finds that the patient has come to normalcy. Also, this is one way that actually the caregivers and the patients actually the feedback itself to the psychiatrist would very clearly indicate whether the drug is working or not working, because the psychiatrist very clearly knows what to expect, because when he looks at the prescription during the subsequent visit, he understands what he has done to the patient and what he expects these drugs to do. And based on the correct feedback that the caregiver or the patient would give, it would help the doctor decide what drugs to continue, what to drop, and what is to be added. So, therefore, an active collaboration of monitoring the altered states, particularly after the treatment, that is psychotherapy, pharmacotherapy, that is giving the psychiatric drugs, is very important. Patient feedback is absolutely essential. The caregiver's feedback is absolutely essential for better treatment. Now, it's a very broad thing. Like, for example, if you ask what are the common side effects, I mean, like, side effect could be anything, but then generally with SSRIs and SNRIs, agitation, nausea, insomnia, dizziness, reduced libido, that is sexual difficulties, and digestive issues are very commonly seen. With tricyclic antidepressants, you will find dry mouth, sometimes some blurred vision. Constipation is very common. See, drowsiness is the commonest thing that one would find with tricyclics. Weight gain, palpitations. These are some of the common side effects. Now, in serious risks would be, like, a person could have serotonin syndrome. You go into confusion, agitation, you have muscle twitching, which is actually called as the tardive dyskinesis. Okay, and then severe symptoms that sometimes would require emergency care. So you have to be very cautious, and you should try to study the changes that are happening once these drugs are given. Now, hyponatremia, that is low sodium levels, particularly in elderly, is quite commonly seen, causing confusions, seizures, and coma. So you have to be very careful. Most of the time, when an elderly patient goes into a coma or a state of confusion, or when he starts blabbering, one thing that the doctor always considers is hyponatremia, and many of these medications themselves can induce hyponatremia because they also have a subtle effect on the electrolyte balance in the body. Because sodium and potassium don't stay together. If sodium level increases, potassium is thrown out by the kidney, so on and so forth. So therefore there are a lot of intricacies involved. So therefore, if such side effects are seen, it has to be immediately communicated to the treating psychiatrist. So some of the SSRIs on long-term use and TCAs themselves can, induce diabetes. They can cause diabetes, and this is basically because of the weight gain they cause, which cause insulin resistance, which actually leads to type 2 diabetes. So therefore, weight gain is another very a common thing that is seen with many of these drugs, and people are very wary about it, and then you have to be very careful. See, young adults, particularly, treatment of depression, one has to be very careful because I told you, suicidal thoughts is something that occurs in a patient suffering from depression. So therefore, if such thoughts are, actually detected, it should be taken with utmost seriousness. And if you look at antipsychotics, you have the common side effects which are anti-muscarinic in nature. So there are certain receptors called the muscarinic receptors, which actually are helpful in producing the various secretions that are required for the normal functioning of the body. So the common muscarinic effects could be secretion. So therefore, a person could suffer from dry mouth, could suffer from constipation, could suffer from difficulty in urinating, and there could also be other effects like blurred vision and hallucination. Sedation is something. See, all these drugs, since they cross the blood-brain barrier and act at the level of the brain, sedation. I mean, like either insomnia or it could cause, sleepiness. So therefore, fatigue. So therefore, one has to look out for these side effects. Um, Metabolic syndrome, as I told you, like for example, a drug like olanzapine causes severe weight gain. Certain drugs cause high blood sugar level, basically because they cause weight gain and increase insulin resistance. Then some drugs cause increased, like olanzapine again, high cholesterol levels, then risk of diabetes and heart disease, because certain drugs have the tendency to increase the heart rate, tendency to have an interference with the various physiological aspects, and therefore it could create heart disease. Neuromuscular issues, particularly seen with a drug like risperidone. In fact, Parkinson like syndrome, where the hands start shaking. So therefore, a drug like risperidone is often combined with another anti-Parkinson drug like trihexyphenidyl. So a doctor would like to combine these two drugs so that these side effects could be taken care of. So therefore, you will find a lot of doctors preferring a combination of trihexyphenidyl and risperidone rather than plain risperidone alone. And risperidone alone has got the problems of causing galactorrhea, which is milk secretion in male, breasts, and gynecomastia, that is painful, enlarging of the breast in case of the male. Then there could be irregular heart rhythms, there could be clotting disorders, which is very rare, and reduced white blood cells. Serious conditions like neuroleptic malignant symptom. Tardive dyskinesia is sudden facial movement, which is not like this. A person starts to have, particularly drugs like metoclopramide, which is and which is actually an antiemetic. It can cause tardive dyskinesis. Similarly, many of the drugs like risperidone, etc., also could cause these tardive dyskinesis. And some drugs itself, like it's believed that sertraline itself causes certain suicidal thoughts. So therefore, whenever a person is on sertraline or certain SSRI treatment, one has to be very, very cautious, right? Um, yeah. So therefore, liver disorders, jaundice, etc., is there. Then other advice. I mean, like these are common. See, you will find adverse effect with anti-anxiety drugs, then the anti-psychotic drugs, and also the anti-depression depressives. So you'll find that there's a lot of these drugs causing similar kind of a side effect profile. So you have mood stabilizer side effects, which is caused by drugs like lithium, carbamazepine, lamotrigine, valproate, and certain thing where you have central nervous system side effects like sedation, cognitive impairment, cardiovascular issues, then gastrointestinal issues, endocrine issues, particularly olanzapine causes metabolic disturbances, which I told you, that is weight gain and increased what you call resistance, insulin resistance, then sexual side effects, which are seen with most of the SSRIs. So these are all the certain side effects that are very commonly seen in your treatment. Now, monitor. See, what is the thing is that you just leave it to the physician, because he knows when, which drug could cause toxicity of liver, which drug could cause toxicity of kidneys, which drug could cause cardiovascular effect. So therefore, you leave it to him. So your regular visits, your regular feedback, your regular interaction, even if it is the smallest and the silliest thing, please do share it with him, so he will be able to solve this issue for you, right? So with due to paucity of time, so I need to, I mean, like, you have issues with certain drugs, and the doctor knows when ECG has to be monitored. His focus on certain drugs which can cause QT prolongation, which can cause arrhythmia. Certain psychotropic drugs do it, so he knows when to do it. And you know clozapine and others can cause potential drug interaction, so he knows when to check for the drug interactions. Then certain drugs which are metabolized in the liver can cause injury to the liver, so he knows when to get your liver checked and monitor the liver. Okay. And see, it's like, all drugs do not cause all side effects to everybody, but these are the side effects that could be seen. So I mean, like, it's not that you really look at the list, then you'll say, okay, with so many side effects, do I need to treat the patient? No, it's not like that. It is that there are side effects, but then when you are in the right hands, he knows how to handle these. And and these do not happen to all patients all the time. So therefore, that being the case, whenever it happens, the clinician knows how to handle it. And generally, a clinician uses a go low, go slow approach, particularly in geriatric patient that is older than 65, because he knows that the other physiological issues are there. He may be having comorbidities or co-disease like diabetes, maybe GI disturbance, and so on and so on. Also, he knows that certain metabolic aspects are slowing down. So therefore, he will adjust the treatment based on that. Also, the doctor knows how to achieve his therapeutic goals. So therefore, he will give the right dose, he will monitor the dose, he will adjust the dose. He knows how to handle it. So leave it to him, he will do it. But one thing is your interaction, your whenever and your feedback is of immense value to the clinician to actually judge which drug to increase dose, which drug to reduce dose, which drug is to be added, and which drug is not to be. Right? So feedback is vital, I told you, right? So that can improve the treatment outcome. It can improve the your relationship with the therapist. and it can help you identify issues, particularly if there are major issues like suicidal tendencies, and individualize treatment based on the patient's experience and the improvement in mental health. So remember one thing, all this happens on an evidence base. So unless the doctor finds evidence in improvement, or finds some patient sliding down, he will not change the medication. So if somebody is well maintained, he will continue till the time that he has evidence saying that he needs there is a improvement, or the improvement is not adequate enough. So, also this question was asked to me. Yes, cost effectiveness generics do give, but we don't know about the efficacy, safety of these, because the impurities etc. needs to be removed. Manufacturing techniques of different companies are different. I would not like to go into those, because I would people would think that I have some vested interest, but then definitely it's always better to take the brand or medication which the clinician prefers, because he knows what is best for you. Please understand that you have to not to indulge in your own treatment, because it could result in irrational things. You could under prescribe, you could over prescribe, you could make an incorrect prescribing, and so don't go based on hearsay, based on interaction with others. You always should understand that rational prescription comes only from the right kind of a person, or the clinician who knows about the medication. So, very important is record keeping. I will close with this, because record keeping is important from that point of view of documentation, because it helps in proper diagnosis, treatment, and patient management, and it's very important for the doctor to adjust, audit, the changes that are happening, and then treat the patient accordingly. So therefore, mental health documentation is very important for continuity of care, and even from a clinician point of view, because it could for him raise certain medico legal issues which would be not in good taste. So therefore he would ensure that documentation, record keeping is very important, that you need to do. And drug to drug interaction, there are every drug has an interaction with certain other drugs, like antipsychotics. You have certain drugs interacting with certain anti-diabetic drugs. Beta blockers and antipsychotics have certain interactions. Co-use of beta blockers with risperidone can increase bradycardia, that is slowing the heart rate, or arrhythmias, etc. So all this the doctor knows, so he will prescribe the medication accordingly. Likewise, statins and like atorvastatin, etc., rosuvastatin, and antidepressant, because these are drugs that actually get metabolized in the liver. If two drugs are getting metabolized in the liver simultaneously, one of them could get compromised, and that is where you could get some side effects and drug interaction. So that the doctor is aware, so he will give drugs that do not come in compete with each other for metabolism, etc. So this is in all my thoughts on the subject that was given to me, and I really do hope that I have done some justice to it. So back to you.
Thank you so much, Mr. Ganeshan. Paucity of time, we'll take a couple of quick questions.
Actually, that's what I mean. Like when you also briefed me, the subject was very vast. So therefore,
True.
in fact, what I have discussed is something. I mean, it's not even tip of the iceberg.
Yeah, we have a question. Person has raised his hand. We'll just take a quick couple of questions and then we have to close. Mr. Sanket Deshmukh, you could speak.
Yes, sir. Myself, Shankar. I have been prescribed amisulpride 50 and sertraline 50. So there is a agitation and restlessness is been observed.
Yeah, these are these are some of the side effects that are seen with amisulpride. I told you because these are antipsychotic drugs, so they do cause. Like for example, even some certain drugs like levetiracetam, etc. They have certain drugs have the tendency to cause that. So you need to contact your psychiatrist. That's why I told you even during my presentation, your feedback to psychiatrist is very important. Now there are an array of antipsychotics available, and maybe if you feel that amisulpride is not actually suiting you, he could always change to something else and help you out. So you have to actually you have to tell the clinician and give your feedback as to what exactly is happening, so that you will be able to get a better treatment, and maybe the doctor may chop certain drugs and then add something else, making it much better for you.
Oh,
So both the side effects which you did mention are side effects that are seen with that drug.
Yes, sir.
okay. Uh,
So therefore, what I would
Doctor,
like to tell you is that why feedback is important is that, see, a doctor may prescribe amisulpride to 100 patients. Out of the 100 patients, 97 of them may not get this side effect, but then three of them would, and you may be one of the three. So therefore what happens is that that's why the treatment is very individualized. So in your case, maybe he may look at an alternative, change it, and he will also look at the therapeutic benefit versus the risk or side effect it is causing. Supposing he finds that the therapeutic benefit outweighs whatever you are facing, then he may even continue with it, because he needs to balance both. Because ultimately, every drug is a chemical entity. You can't say that I have to get a drug with no side effect. That is not possible.
could I
Okay,
just
sir.
doctor,
Yeah.
I am taking for 40 years haliperidol 5 mg. So what will be the side effect for 40 years?
How? What are you having any? That's why. Are you having any side effect?
Only fingers are cramping, that's all, nothing else.
Fingers are
Fingers are cramp in fingers.
cramps. No, cramps may not be because of heliperidol. Maybe due to some
Risperidol
other
also is prescribing risperidol.
Nay, and then what I am trying to tell you is that it is not very, it may be seen but not very common. You need to understand, I'm not a clinician, so I will not be able to give you that, because a clinician who is treating you will know your profile, will know your history, will know what is good for you and what you are being treated for. So therefore, you will have to contact him only, because that, I mean, like even vitamin E deficiency or vitamin B12 deficiency can cause these symptoms which you are saying. So therefore, there is no standard rule. So therefore, the doctor will know. And then with haliperidol, we don't know what else you are taking. I mean, what interplay is there? So therefore, only when a prescription is seen, when a doctor actually sees, he will be able to actually give you a solution for these side effects.
thank you so much, Ganeshan sir. Could I just ask you one quick question before some of the questions which our members ask is, how often should we see the doctor? What is the frequency? What about the intensity of the symptom or the duration? So quickly, before we close, I mean, how often is the consultation to be?
I would say to start with, at least, see, I think initially what the doctor does is it depends on supposing newly diagnosed 1 week, 15 days, because what happens is the doctor wants to actually know he has put you on a set of drugs. He wants to know immediately as to what exactly is happening to you. So there he may, the frequency depends on your longevity of the disease. Are you getting the point? See, someone who's see, I'm let's say I am taking an antidepressant, and I am taking an antidepressant for 6 years. Then, if I am taking an antidepressant for 6 years and I my symptoms are relatively less, then I would visit a doctor once in a month to find out, and then tell the doctor that yes, this is the to just check on him whether everything is okay. So it actually depends on the longevity. Supposing I am newly diagnosed, I have been put on a medication, I have certain, so doctor wants to know what are the effects, what are the side effects, what I need to. So till the time you are stabilized, he will want to see you as often as possible, maybe once in a week or even once in 15 days. So actually so as the longevity proceeds, your frequency starts coming down.
Thank you,
And
doctor.
sometimes, like for example, I would look at a disease like, say, a convulsion. A child has a convulsion. Now, a doctor puts a patient on, say, a brivaracetam or a clobazam or a levetiracetam syrup, and then he initially sees the child for first week, second week, and then fourth week. Then he understands that the convulsions, or the see, he looks at the episodes. The episode is very important to determine the frequency of visit. So supposing the doctor finds that the episode is very well controlled and there is no episode of epilepsy, he will say, okay, well, you meet me once in 2 months, once in 3 months. Then he continues the drug. Then after 3 years, he will withdraw the drug, and then he will see whether you get the disease again. Then again, if you get it, he will continue. If you don't get symptoms, then that means you are off it. You're really managed it well, and you have got over it.
Thank you so much. I think you hit upon it when you said there is no health without mental health. I think that's a very crucial point to take away. All round, all round biopsychosocial, all the three aspects of treatment have to be have all three aspects, biopsycho and social, have to be considered.
Yes.
And I would thank you again for sparing the time. We overshot. My apologies.
No, my apologies, because the subject was very deep. Because I thought of discussing more on the side effect profile. See, basic psychiatry as illness, and then the drugs and the side effect profile.
No, we
And
had a good overview, a good overarching overview, and I really appreciate the time you spent with us. And just to tell everyone that this recording will be available in a short while on our YouTube channel. And I'm sure a lot of you would have taken notes, but I can tell you that the names of the drugs which have been shared by Mr. Ganeshan will be available for review, but do not substitute the advice and the information given here to a professional's direction. And with that thought, thank you so much, everyone, for being here with us. Thank you, Mr. Ganeshan.
And I would like to thank the Ekalvya Foundation for having given me an opportunity to actually interact. And I do hope that I did make some justice to the subject that I was given. I will share my email ID with you, and if in case offhand anybody wants anything, we can always, I'm always in contact with the psychiatrist. I can always interact with them, and then, if there are certain issues, then we can direct people. So, I mean, we have operations all over the country. So, certain psychiatrists are good at certain things. So we can always help you in those things. And if there are anything adverse or anything that is seen, you can always, this thing, we have a medical team also in the company, which, is well versed. So we could always take their help also, and then, we can mitigate the issues of the people. So happy mental health and happy well-being. Thanks for the opportunity.
Thank you so much. Manjari, you have shared the email of Ekalvya Foundation.
I I'll share it within a few minutes, okay?
Okay. Thank you so much again, everyone. And just be happy. Don't worry. Be happy, as the song
Yeah.
goes.
Actually, your feeling that you are mentally all right is more important than anything else, you know,
Yes.
and therefore, I'm sure that that itself and exercise, see, exercising in the morning is very important. It